Hi, I'm Dr. Edgar Campos from Mexicali Bariatric Center. The reason that I want to talk to you today, it's the post-op test. Normally after we do any weight loss surgery, we try to perform for your safety a lot of post-op tests. The post-op tests have two reasons. The first one is basically a leak test, so we can know that everything is running properly inside of you. During surgery, we do the first leak test. And it's quite simple. When we staple and cut your stomach, we over-suture the staple line. And the first thing that we do is insufflate the stomach with air. With a little tube that goes inside the stomach, we pump air inside. So we put the stomach below water, we rinse the abdominal cavity, and we create something like a pool where the stomach will be below the water. And it looks like a flat tire test. We check for bubbles. There are no bubbles, there are no troubles. Your stomach is fully closed. So that's basically the first leak test. Then we aspirate all the water and we leave a drainage. A Penrose drainage is a soft rubber tube that goes on the side of the staple line, and it will be basically collecting everything that surrounds after surgery. Normally it drains some reddish liquid that is remnant from the blood mixed with water, but then the liquid will begin clearing up and it will be like a citrine liquid, yellowish, so which is a normal liquid. The reason of leaving a drain, it's basically because we could perform leak tests on the second and the third day. Normally when something happens, it usually happens the first 3 days, the time that you're in the hospital. That's why we leave the drainage for the first 3 days, the time that you're in the hospital. Second leak test, it's basically a color test. We give you a blue liquid, it's methylene blue mixed with water, so you can drink the blue dye. The blue dye will stain everything, and you will see that your tongue is basically stained blue. And then you'll be drinking the liquid, and we check that everything goes inside the stomach. And because you have a drainage that is on the side of the staple line, if the drainage is negative, if nothing of the blue dye comes out of the drain, it's a good sign. Everything is running properly. So that's the second leak test. And then after that, you will begin drinking your liquid, so we know that everything is running properly. And then the third leak test, it's basically a leak test, but then it's a test that will give you an idea of how your stomach looks like. We use barium on the X-ray room. Basically, we use the fluoroscopy room, which is like a live X-ray that you can see basically everything, how it's moving and the shape of your stomach. The reason of using barium on the live fluoroscopy is because we can perform a very good leak test, but then you will be able to see your own stomach. You'll be able to see the shape of your sleeve. You'll be able to see how it's working. So that's a very good picture that you can keep with you, and you say, that's my stomach, that's how it's working. So you can see that it's very narrow, and you understand the reason of the surgery and how to work with it on the long run. So basically, the barium test, it works properly as a leak test, but it works as well as an illustrative test for your stomach. So we can see that your stomach is narrow on the top, we can see that your stomach on the bottom is very narrow, and we can see that the pylorus, that is the valve that separates the stomach from the intestine, is working properly, so everything is running well. Then after that test, you will continue with your chicken soup or the rest of the liquid, and we can remove the drain because it's safety to return back home.